my name is Jean Carlson, and I am a certified occupational therapy assistant. So I have my associate's degree in occupational therapy. We work on helping people be more independent, regardless of where they're at physically. Some people would just fall, just walking along or anything, sometimes tripping over their feet or tripping over a chair, anything. Hit your head, you can break your hip, you can hit the table, you can hit, I've had a woman who hit the toilet and she broke her neck. For people over 65, it's very, very common. And I looked it up, 30% of all adults over 65 will have a fall. And so 20% of those falls will cause them to go to the hospital. And then 40% of those will be admitted into the hospital because they've had a head injury, they've broken their hips. Those are the two common ones. So of course we treat the injury itself, a lot of times they have to be non-weight bearing on their hip or whatever. If they've had to have hip surgery or if they've had a brain injury, we have to treat that injury. So we will mostly focus on strategies to help them prevent falling again, if that makes sense. We teach them what they need to do as far as keeping a walker with them, being careful when they get from sitting to standing. There's a lot of people like to get up and go, and so a lot of times we just have them stand up and take a moment and walk. So we just give them different strategies to prevent it from happening again. Well, one of the big things is getting rid of clutter around the house. No rugs around the house because they can trip over that. Having night lights in the bedroom and in the bathroom because a lot of falls, I'd say majority of them, happen at night when they go into the bathroom. Making sure if anything is in the way that could be clutter, spills, anything, they should have that cleaned up. No slip socks, if they're gonna be around the house. If they're gonna have shoes, it's gotta have good support. Slippers really aren't the best because they can slip out of them. So we really want them to have good shoes or at least have socks that have the no slip treads on them. For sure. Of course we can. We do everything we can. So, and it's really up to the person, if they understand why they fall. A lot of people don't understand that because they have dementia or they think they're not old, or that can be an issue. There's always some good websites out there, just Googling fall prevention, and they've got really good resources out there to help you as far as finding out what kind of equipment could help you, what you need to do around the house. This is actually really good for the family members who have elderly parents or somebody in the house that is compromised physically. That is a fall risk, and they can just look up fall prevention and there'll be some good resources out there.